I'm Susie Blaylock. I'm the current state president of the Alabama Society of State Anesthesiologists. I'm a practicing anesthesiologist in Muscle Shoals, Alabama. I'd like to just give a personal story. I was an anesthesia nurse. I trained at UAB. I worked at UAB and Caraway Hospital. I did open heart anesthesia under care team management. I went back to anesthesia school because I knew I was practicing at the full scope of my practice, and I knew I was going to be doing anesthesia for the rest of my career. I wanted to do the best and the most that I could do, and so what I knew is that I needed to advance my practice and my scope of practice by deepening my education. I went back to medical school for 4 years, and I went back to anesthesiology residency for 4 years. And it was during that time that light bulb after light bulb went off in my head, and I thought, oh, so this is why I've been doing what I've been doing over the last few years. Oh, now I understand why this doesn't always work in the operating room. Oh, I can see where I could maybe save a life or do better by a deeper understanding of the medical diagnosis and treatment of my patients. You know, I work in a small town. We've worked in a medical care anesthesia direction team, and I'm convinced that having an anesthesiologist immediately available saves lives. I had a patient, a 42-year-old lady. She was a mother of two. Me and the anesthesia nurse had a plan. We got into the operating room. We knew we were going to have trouble with her airway. We started, and as soon as we started, we lost control of her airway. She did not get oxygen. She started turning blue. We had seconds to act. We managed to, acting as a team, to get enough oxygen in her to save her life, while the surgeon made an emergency cut in her throat and put an emergency tracheostomy. That lady's alive today because we took care of her as a team, and I'm convinced that if we did not have medical direction and medical access, she would not be here today. Thank you.